Okay, this is Beth Stroll, and I too would like to welcome you to this meeting of the System of Care Expansion Leadership Learning Community. Today we're going to be discussing match requirements and strategies for meeting those match requirements for System of Care grants. And to start off, I'd like to tell you just a little bit about the learning community. Some of you have participated previously in our two meetings that we've held so far. Others are new to the learning community. We are holding these learning community meetings monthly, and we've designed them to support you, the leadership in grantee communities and in other areas, states and communities that are working on system of care expansion, and that would include PIs, PDs, leaders in content areas such as family and youth engagement, social marketing, and others. And any other leaders identified by the sites who you think may profit from participating in any one of the learning community meetings or in all of them. And what we'd like to do is address topics that are important to you, but we want to make these interactive. We will always have some brief informational presentations, and we will follow that with dialogue and Q&A sessions so that we can answer any concerns, address any issues that you may have in each of these areas. Today, we are addressing an issue that many of you raised as a concern. We have both current grantees and prospective grantees who are thinking about applying to the new 2016 announcement that was just released over the weekend for the System of Care Expansion and Sustainability Cooperative Agreements. And match has been a concern expressed by many of you. There are questions that you would like to have answered. So we would like to use this learning community meeting to give you an overview of requirements and match sources, and then also answer your questions. We have three individuals who can answer your questions today and are outstanding resources. Gary Blau, who is the chief of the Child and Adolescent and Family branch at SAMHSA, and Gwen Simpson, who is a grants management specialist at SAMHSA, and Eric Lulow, public health advisor who also works with the Child, Adolescent and Family branch. We're going to start with a brief overview of requirements by Gwen Simpson, and actually, I misspoke. We're going to start by some opening remarks from Gary Blau, followed by some information on match requirements and strategies from Gwen, and then we will open it up to questions and answers. And why don't you begin, Gary, with your introductory remarks?
Awesome. Thank you, Beth. And welcome, everybody, and appreciate you all being here. Certainly, match is one of the issues that folks have always said has been of concern, and I would tell you, so don't fear the match. There's lots of ways that you'll hear about that you can meet match requirements, and honestly, I think that we are here to try to help you do that. Match is an important part of the Children's Mental Health Initiative, and it's been an important part of this program since its inception back in 1993. When the statute was written, it included the requirements that there be local match to the federal dollars. And part of that was really because the framers of systems of care, in essence, were trying to find ways to develop sustainability options from the very beginning, and the thought is that if you would have increasing levels of local requirements for match, that it would help local communities and now state governments, territories, tribal nations, etc., to put resources into the system of care over the course of time that would then get sustained, so that it wouldn't just be another federal program where we would come in for a certain number of years and then be done with it, and people think of it as a program, rather that this is actually a framework, an approach to services for children, and youth who have serious emotional disturbance and their families. So that match really was developed as part of that process. And we've developed it over the years to say, look, it can be it's always non-federal. You can't use federal dollars to, match other federal dollars, but It can be non-federal in terms of other public or private kinds of funds. It can be cash or in-kind that's fairly evaluated. And so the whole idea here is that we are actually partners in doing this. Now, over the years, we've changed the program a little bit. So the statutory requirements are that as we begin the program, that it's 1 local dollar to 3 federal dollars. So if you think about it, when we first begin, for those first several years, the federal government provides those $3 to the 1 local, and it's much easier to meet the match requirement in those first several years because it's heavily skewed towards the federal dollars. Now in the 4th year, it changes to 1-to-1. And because of the nature of how the program has evolved as a 4-year program, that means that in the last year of the program, and with the new funding announcement that just came out, that means that the last year it's 1 federal to 1 local dollars as this transitions to more local requirements. In the old days, that then when we did 5- and 6-year grants, that meant that in the 5th and 6th years it was actually 1 federal to 2 local dollars, which then became an even more challenging way to meet match, especially when it was such challenging fiscal times. So the bottom line about all of the match dollars is that we have tried really hard to come up with strategies to build sustainable budgets that adhere to system of care values. And what we really do recommend that those sites that are successful in their financial plans collaborate well with other agencies that create sort of joint planning and case planning certification programs that are really working on this and create joint strategies for success so that they can come up with ways to redirect funds to meet their match requirements so that it can not only be in kind, it can also be some of the cash that can occur when folks redirect services, especially high-end services, into the community. So that's really what we're here to do, and I am really excited today because we have what I consider to be probably the nation's foremost expert on match, our guru, who we go to for all things match, and that would be our grants specialist, Gwen Simpson, who's going to share a little bit from her perspective about the match requirements, and then we're going to throw this open to folks and really have an open discussion and questions and answers. So let me turn it over to Gwen.
Thank you, Gary. So this is one of the slides, since Gary has already spoken with you about what the match requirements and in terms of the match ratios, we can kind of move to the next slide on this one. I don't want to have to repeat it. So some of the matching sources may be in cash or in kind. So cash, when we talk about cash, we're talking about the recipient organizations' non-federal revenues, or in the case of state funds, case of county or funds, it would be their county funds. In terms of in-kind, you can charge, as far as in-kind is concerned, personnel. And in personnel, in terms of that, would be the value of staff time working on the grant project. So the salary, how you account for that and calculate that, it will be based on the salary or the hourly rate, based on a regular rate of pay for that particular position. You will have volunteer services by contract, consultants, third party, professionals, technical personnel, and other skilled and unskilled labor. The rates for those third party volunteer services must be consistent with those paid for similar work by the non-federal entity. So we quite often get questions related to that. How do we go about calculating staff person's salary or accounting for that in the budget? And these are the things that you would need to be basing, the salary staff and the professional staff and hourly rates on. In-kind also can be donated property, equipment, which includes equipment or office supplies. And the value assessed is based on the fair market value of the equipment or the office supplies. You can also charge as match donated space. The space for your, an office space or a conference room space, you can base that on the fair rental value of the space. You can also charge indirect costs as non-federal match. And that would mean that if you're having a federal negotiated indirect cost rate agreement, you can choose to either charge that as full non-federal, apply it to the full non-federal piece of it, or to the federal, or you can split it. You can split that indirect cost and charge part of that as federal cost and the other part of that as non-federal. So in terms of reporting and how you go about maintaining records of your non-federal match, of course you know that the federal match must be verifiable. So you need to document the value of the services and goods by the same methods used internally by your organization. So in terms of that, I would highly recommend that you speak with your financial folks there or your auditors or your accounting folks to help you maintain some kind of records of your non-federal, of your in-kind match. Okay. So my piece was really quick. If you have any questions.
Actually, Gwen, this is Eric. I have one quick question about in-kind match. That being match needs to be related to the goals of the grant, correct? Like it can't be like if Disney were to give us, a year's supply of free passes, we couldn't, consider that to be match because it's not related to the goals of the grant program, correct?
That's correct.
Well, that kind of sounds like if that was part of some people's treatment plans, though, Eric. What do you think? Well, maybe that would push it a little too far, but yes.
It's something that you could consider,
But in many ways,
that's a good question.
A lot of folks think if you could have spent grant funds on it, like transportation, like a vehicle or something that otherwise you would have spent grant funds on, but that you're paying for out of other funds, that's match.
That's match.
Okay.
As long as it's related to the project activities. Right.
We have somebody wrote a question that they're using a lot of they're highly leveraged with Medicaid, and any new money that they're getting is going to their Medicaid match. So they would benefit if those match dollars could also be considered as system of care investments. The problem that we would have with that is that you can't use the same dollars, the same federal dollar. You can't match both Medicaid and excuse me, this other program at the same time.
That's correct.
We have also a question from Jim Gillespie. I think we're unmuting your lines now, so when I recognize you, also if you'd like to ask your question verbally, you can. But Jim's question, as you can see in the chat box, is that their county has a local system of care initiative, began in 2015, and budgeted $1.1 million using local dollars. Can that budget be used for local match?
I'm trying to read this again. Our county began a local system of care initiative in the summer of 15, budgeted at $1.1 million annually. That was what the county did. This was without federal. This is all local dollars. Can that be?
Right.
Can that budget be used as local match?
Yes.
Gwen said yes.
As long as it's non-federal.
As long as those dollars were non-federal. You're bringing those to the table, in essence. So let's say that you're applying now for a new grant, then you'll be able to say that you just began that initiative, you just brought those dollars to the table, you're going to use those as match for whatever the new activities are, or if you already have a grant, I don't know if they have one or not, then those could be then identified as monies that are being brought to the table by the local government.
Okay, I believe that you can see the box in the center, and if you put your name in the bottom left, we can recognize you to ask your question. Okay, we do have some other previous questions that were asked.
I'm trying to stay up with them.
Can you provide examples of ways to fairly evaluate in-kind match?
Okay, that's a little more tricky. It depends on the kind of in-kind match. So let's say, Gwen, that they're trying to estimate people's time, because that's a lot of time that they have. You know, people are coming in. They're coming in for a big meeting, and they want to. You know, family members or other professionals are coming in from. You know, to hold a big planning meeting. How might they evaluate their costs?
That is a good question.
Okay. The way that we've often had it done before is that they would take what would be a normal cost of doing business, which may be different in Arkansas than it is in Chicago. But what they would normally pay for a service like this, whether it's, say, $20 an hour, or if it's a professional service of $50 an hour, and use that as the basis, because that would be a fair market value for that particular activity, and then estimate that across the number of participants that are there, and then they could come up with an in-kind, because all these people came to this meeting, and then they, let's say, just for the sake of my math, make 10 people at the meeting, and estimated that they were, you know, for $50 an hour, and it was a 2-hour meeting, so it's $1,000 of match.
And that makes sense.
And that would make sense because it's audit proof, and it would be based on a fair market value. So that would be like a way to do that for goods and services that you could estimate.
And you want to make sure that you document that. You can have a sheet of some sort with identifying the individuals that are attending, and go back to your financial folks to help you determine what the fair market value of those.
Yeah, when people do this, we strongly encourage them to actually have a sign-in sheet with, specifically, what the person's role is, their name, et cetera, so that you can actually count that as match. So I don't know if that answers the question, but that's often what we get when we talk about people's time related to in-kind. Now, there's other things that can be in-kind as well, like I said before, transportation services that are being provided.
Any kind of equipment that they're using towards that. And
then all of that is just based on what the normal actual costs are, as long as you can, document those.
And a related question then is how, do you have some suggestions or guidance on how to track and record in-kind match? Or even examples of that can be provided?
Just gave you
one. So each grant, in my experience, has done it a little bit differently, that they often will create a spreadsheet, based on what their budget folks want them to do. And the project director or the principal investigator will look at for each different kind of thing, whether it's goods and services or, meeting participations or, rental, whatever, and literally list all that out on a spreadsheet and then have the budget amounts identified so that you just literally input it into the spreadsheet and then have the budget people agree and sign off on that, and then that becomes in kind, or that's the match.
But also, and I state on the slide, the last slide, that you should document the goods and services by the same method that your organization and you use internally by your organization. So I would look to, because that's going to become a part of your audit information. So you should look to your, the financial folks again. You should look to your business folks in your organization to see how the match should be documented.
Okay. Are there any examples of this kind of a spreadsheet, or or some of the documentation that's been provided to SAMHSA that we could get out to the participants to show?
We're hesitant to provide that level in terms of example, because every locality is a little bit different from that perspective, and it really has to comply with the local budget folks their way of doing it, because the local budget folks really should be involved. One of the things that we often will say is that this is a partnership between the program side and the budget side, so that folks should be planning together in terms of doing this, and that and really working on combining both the program and the fiscal expertise, so that you can literally map these potential funding and actual funding sources together, and that you might also join with your other partners in doing that, so that if we simply gave a template for it, then it may not really meet the spirit or the requirement of that local community, and then it becomes an issue of, well, the Fed said this versus the community, and so we're very hesitant to do that.
So, I mean, and I guess my question would be, what methods are used internally to document any of the any costs involving within your organization?
Okay.
So I would stay with that.
Okay, great. Modesta, you have a question about valuing family and youth participants. Would you like to pose that question? Okay, let's just go ahead with that. The question is about how others have valued family and youth participants.
So again, that in every local community, it is done a little bit differently, but like I said, that the value of any good or service. So in this case, I look at a family or youth participant as a professional service. Now that service, may be different than somebody that is has an MD versus this. I mean, all of these different things are based on the community that they're in. So in New York City, that's going to probably be a little bit higher than perhaps in Fayetteville, than it may be in Bethel, Alaska. So all of that is a little bit different. So as long as you have a justifiable way of demonstrating or documenting that value. So what is it that the agency typically pays for those services? Or what does it typically go for in that community, that you could say that, that a job of this nature gets this amount, an attorney gets paid this much, or a doctor gets this much on average, or, somebody that does peer support services. And then if you identify that amount, then that is a legitimate and justifiable way of documenting the value of that particular good and service.
Okay. Jim, you had another question? Jim Gillespie?
Read it.
Okay. Jim wanted to know that applicants can only include as non-federal match contributions in excess of the average amount of non-federal funds available to the public entity.
Are you
over
ready
the
to make a difference?
Fiscal years preceding when the federal award is made. How does that relate to the local system of care initiative funded that actually began in July 14?
I'm not sure that we're directly understanding this, so I think it might be best for Jim to talk directly to his government project officer and Gwen offline, so that we can make sure that we're understanding this better. I'm also seeing a couple of other questions coming on board that I think may have been answered. The new grant itself, there is a listing of who is eligible. If you have a current grant, and that is a grantee that was awarded in fiscal year 13, 14, or 15, then no, those are not eligible. But the grants that were awarded in 2012 that are coming to an end, irrespective of whether they're in no-cost extensions, are allowed to apply for the new grant that just came out. So that, I think, has been answered. Also, one of my staff is identifying, Andy Hunt, that it is important to remember that the documentation of the match has to meet the same level of scrutiny in terms of auditing abilities that all the other federal costs have. So if you're going to document, if you're going to do the match, that it also has to meet audit requirements. And that's why we encourage and that's why we don't create all of the forms and stuff. That's why we ask and encourage you to work closely with your local budget people to meet your own audit standards.
Okay. I'd like to remind you that you can ask your question verbally in the box on the left under the presentation. If you indicate that you have an additional question, we can call on you and recognize you. The lines are unmuted, and you can ask your question verbally, and we can have an interactive discussion and dialogue here. You can type your name, and would you clarify, Tyler, do they type their name in the box that says type your answer here?
Yeah, you just type your name there like Jim Gillespie and Emily Province did, and then they'll say, okay, Emily had a question, and then you can ask a question.
Right. So rather than only using the chat box, if you put your name there where it says type your answer, that would be your name, and we can recognize you, and you can initiate a discussion around your question.
And as you guys are doing that, I'm going to reiterate something that I see in the chat box that Andy and Ruth are doing, and that is that Andy is correct. Funds must be matched at the rate of the year they are being used. So so if you carry forward funds from year 3 to year 4,
it's got to be matched at that rate.
That means that it goes from the rate of 1 local to 3 federal to 1 to 1, which is why we encourage people to use the money in the year that they get it.
Okay. All right. Another question go ahead.
This is Denise. I just wanted to follow up with that dialogue. And Gwen, could you advise as to whether or not and in what circumstances match that has been accrued but not claimed may be carried over?
I'm not understanding the question.
When you can say
that again?
When you can carry over match?
When you can carry over match?
Correct.
Okay, so you can carry over match when you are requesting to carry over unspent, the federal unobligated amount of federal funds from one budget period to the next budget period. So if you're going into year 2 and you have some unspent federal dollars that you want to use in the second year, let's say, just use that as an example, if you have excess match that you did not use in year 1, you can carry those funds over as well into the second year to go along with your carryover. Does that clarify, answer your question?
Yes, thank you.
Okay. Hi. One question that was asked in advance was about food donation. The question is that food donation has been debated since the beginning of our grant. Food is not an allowable expense, therefore doesn't categorically fit into match funding. Many times a meal is used as a draw. However, we are unable to document donation made by organizations or individuals. Is this correct?
I know.
So it is correct that meals are not allowable on the grant. However, like what we call light snacks, refreshments. I'm not sure exactly how it's worded in the FOA. I think it may be worded light snacks.
I don't think we actually put it in the FOA. Is it?
We do, under funding restrictions.
Oh, it's in
up to $2.50 per person. That's the maximum. So you can, spend on light refreshments up to $2.50.
And that can be matched.
That can be matched.
That's good.
Now, so I wanted to clarify now. So you can, if you charge $5, let's say for a light snack, you cannot split that $5, $2.50 for federal funds, and then $2.50 match. It is the maximum of $2.50. So either you will decide to either have it federally funded, or all of it, or
it's matched.
It was matched, all of it.
Does that clarify? That seems to make sense to me.
Okay. Bill Bain, your question is about whether there's still a requirement that match dollars are new, meaning over previous funding levels.
And the answer to that is yes. I mean, if you think about it, that's the way sort of the feds work. I mean, if you think about it at its most simplistic level, if we were to give, the federal government were to give, a local community $1,000, and we're not allowing you to supplant your existing money. So that doesn't mean that you can say, oh, wow, I got this new $1,000, so I'm going to take $1,000 that I was already spending and do something else with it, because then that sort of defeats the whole purpose. So it is essentially that you have to maintain your level of effort that you had historically over for your previous funding level, and then the federal dollars then are in addition to that. So it does mean that that these dollars that you're getting are over the previous funding levels. Now, that is the general way of us looking at how we approach the federal grant dollars.
Okay, and I think this is a related question that came up previously, that if we are able to draw down additional service dollars through a Medicaid state plan amendment or waiver, can any freed up non-federal dollars be used as match, or are these funds excluded due to maintenance of effort requirements?
So yes, the answer to your question is yes, you can use those freed up non-federal dollars.
Yeah, because and especially since you're still using them, that's still part of your maintenance. You're still effort. You're still using that as effort. So they would be considered as now state dollars or local dollars that could be used as match.
So the operative word is non-federal.
Correct.
Okay. Leanne Lindsay, we talked a little bit about valuing family and youth participants, and the answer was that there are different ways of doing that. Is there a way, again, to get in contact with some who have done that and get some examples of how they have valued that?
Yes, I would actually check with your government project officer specifically on that offline, and they'll be able to help get you linked up with sites that have historically been successful in doing that.
Okay, great. Sheila Pyres has a question. If you're redirecting existing dollars from ineffective children's behavioral health services to home and community-based services and a system of care approach, can you count those dollars?
As long as if they're non-federal, then yeah. I'm not sure what Sheila's trying to get at, but if they are, I'm not sure what she means by ineffective child behavioral health services, but if you are taking and redirecting dollars, and many of our grantees historically have done this through the use of, say, dollars that the state or the local community was spending on residential or inpatient levels of care, much higher end care, and redirecting them into home and community-based care, those are absolutely can be counted as match.
Okay. Sheila, did you want to clarify that or add anything else?
Yeah, so Gary, if you can't, my question is this, if the match dollars must be over previous funding levels, and so it's, let's say your children's behavioral health budget was $10 million, but you've redirected $2 million of that into home and community-based services, and you want to count that, they're all state monies, let's say, you want to count that as match. Can you do that?
Yes, because again, you're still using those dollars as effort, so you can still use those.
So it's the match dollars then in effect have to be over previous funding levels for system of care related types of activities and services. Correct?
The match dollars, I'm not exactly sure I'm understanding, Sheila, that if you're talking about redirecting dollars, and this is what I'm hearing, the most important component here is the redirection of the dollars, then they're still part of the system, they're still a part of the effort, and they're simply being moved from one part of the system, high end, for example, or they're been freed up from, other dollars into the system of care, then those are absolutely counts as match.
Okay, it really harkens back to Jim Gillespie's question and the requirement on page 21 that he's citing, that non-federal match contributions in excess of the average amount of non-federal funds available over the 2 years preceding the fiscal year, that they have to be in excess of that. And your budget, your budget may not shift, but what you're spending the dollars on may shift, which is critical. And so
Correct.
So even though it's no more than what you were spending in the 2 previous fiscal years, you're spending a percentage of them on system of care related services and supports, and so you can count them.
That is correct. That is the way that we look at it. So your maintenance of effort is still the same, and you're infusing money into the system of care, into the home and community-based service system of care. So that's where the leverage point comes in. So all of that counts.
Thank you.
Okay. Hi. Hi. This is Emily Provence, Stark County, Ohio. Can you hear me?
Yes,
Yes,
go
Emily.
ahead.
Okay. I would like to give an example if I can, because my question is also about the paragraph on page 21. So we have some local money that we put into school-based services. And just for ease, I'm going to use some made-up numbers. But in 2014, we spent $400,000 on those services. In 2015, it went up to $500,000. And in 2016, our current budget, we've increased to $700,000. Does that mean that we can only use the $200,000 increase from, fiscal year 15 as match? We can't use the entire $700,000?
We're trying to caucus a little bit, because I think that my answer would be yes to you. So I think that that sounds correct. And again, we don't want to give, we can't in a webinar without having you go through a government project officer or getting something more formally responded to, that we can't have this count as official responses without having it go through some kind of a channel. So that's why we're being a little bit more cautious in our response.
But your answer would be yes, we could only, your unofficial answer would be yes, that we can only count the additional 200, not the entire 700, even though it's all local money.
Well, and again, I think that the way in which that you framed it, I think that would be correct, yes.
Thank you.
Okay. Another question here is, how do you suggest carrying over unused match dollars? What do we need to do? Now, I know we addressed this before, but it sounds like there may be some clarification needed on it.
Well, it would be the same practice as carrying over, unspent federal dollars. So you would simply, if you're an existing recipient and you are in a current year, you want to carry over the unspent federal dollars from the previous year. You have to submit a budget, detailed budget outlining all of the unspent federal carryover dollars, federal dollars, and match as well in your budget. So it'd be the same principle.
Okay.
So Gwen, this is Denise, just as a point of clarification. So that would be put in the carryover requests, which are usually due by the end of January each year.
It changes every year, so for this year it's January, yes.
Great, thank you.
Okay. All right, Connie Goodson, I'm not sure if your question was answered. When will awards start? I'm assuming you mean new awards that will be coming in, the applications for the 2016 awards that will be due in April.
Yes, you did answer my question. I was talking about the new awards.
Okay, great.
Thanks.
So let me just do a quick response to that. Typically, we've awarded these grants, and notices of awards are sent, typically around September for a start date of September 30th, and that would be that's typical. There have been other grant programs or other times when that has varied. So it sort of depends on a variety of factors. This is a more complicated grant program, grant review activity, and so it does take that full amount of time. If folks notice that they have all the way until April 25th to respond to this grant announcement, the funding announcement, and then there's a whole back-end approach to the review, et cetera. So that's the likeliness of it. But the ones who are selected, the specific start date will be issued on the notice of award.
And so, and my general response would be that all awards will be issued and recipients will be notified no later than September 30th.
I usually say to folks that if you have not heard anything from SAMHSA by September 30th, that's bad.
Oh, no.
Yeah.
Very bad.
That's a bad sign. Yes.
Right. So, also, while I have you guys on the line, it's very important that in that grant application that you have a business official, a good business email address for your business official, because the notifications will be emailed to that business official that you identify on that checklist form in the grant application.
And there are sometimes questions during the course of the review process that pop up that have to be answered, and so it's really important. And it may or may not mean that you're going to receive the award, but it's important that no matter what, if you don't answer them, then it's not a good thing. So those things really are important. We also had a couple of questions about challenges in meeting the match requirement if you can't meet the match. So, for example, you're going into the last year and all of a sudden the one-to-one match becomes a problem, and you're supposed to get $1 million, but instead you can't match it at $1 million, you can only match it at $500,000, and the question has become, well, can I ask for less money? Because so instead of asking for a full $1 million, can I ask for $500,000 because that's what I can match? And actually the answer to that question is yes. You can reduce your request in order to ensure that you can meet the full match amount. So I don't know if that answers Tamika's question in terms of meeting the actual match amounts, but you can reduce the amount that you request to meet your requirement.
On each of that, each of the brochures, if you could put them in there with a little tab sheet.
Okay, was the question answered to your satisfaction on how do you suggest carrying over unused match dollars? What do we need to do? That was answered sufficiently?
I believe it was.
Okay, in terms of putting that in your carry forward request. Other questions?
Beth, this is Denise. I believe Emily Provence was the first to type her name in the box, and I'm not sure if we've heard her question.
Emily?
Yeah, I'm still here. Yes, I did get to ask. It was similar to the other questions about page 21, but I think that we have some clarity.
Great, thank you. And then Lucinda, you had typed in the chat box a question about valuing folks' time who participate in focus groups. Gary, Gwen, and Eric, is that the same as participants at a meeting? Just the fair value of their time?
Yes.
Great.
Another question that was asked previously, what are the match rules for tribes and tribal organizations? How do they differ?
So it is a little bit more complicated for Indian tribes or tribal organizations. in terms of the potential, sources of match funds and what can be counted. Sometimes because of the way in which that the tribal nations are able to draw down federal dollars. So we often will look at some separate technical assistance specifically related to that. What I will say is that sometimes tribes will draw down funds through the Bureau of Indian Affairs and the Indian Health Services that are often referred to as 638 funds. Those funds, if they are a 638 tribe, actually that there are strategies for those to be counted as match, which is different in terms of because some of those are federal, but those are allowable under this circumstance. So that's an important distinction of the use of federal dollars from a Bureau of Indian Affairs or Indian Health Service for those tribes that qualify under 638 funds. So if those funds, and thank you, Andy, for jumping in. So yes, you can count those. There are other tribal funds that can come from various sources, casinos, other systems. Their in-kind matches and donated time, similar kinds of things, absolutely can still be counted. And so again, those are strategies as well that work in both Indian tribes or tribal organizations as well. But the main difference in many respects is related to the Indian Self-Determination Act, and which allows federally recognized tribes to get federal, to take funds from federal agencies to operate programs for their tribal members and then use those funds as match for this program. And that is allowed if they are a qualified 638 tribe.
Okay. Jim Gillespie, another question. For this grant series, is the fiscal year when the award is made 16 or 17?
Okay, so this is federal year. This is federal fiscal year 16. It qualifies from October 1st through September 30th. So we are operating on FY16 funds, and the new dollars or this new FOA will be issued in federal fiscal year 16. So it will be federal fiscal year 16 funds that get expended next year. So that's the tricky part, is that you're getting funds from federal fiscal year 16 that are being spent in federal fiscal year 17. But that's the nature of the way the federal government operates, and often that's the way that state governments operate, except they usually do it from a July to June fiscal year as well. But again, these are FY16 funds that we just issued the announcement for that will be awarded by September 30th, and then starting October 1st is when the actual funds then get expended in what begins our federal fiscal year 17. Of course, this year there'll be some presidential elections happening. We're likely to undergo a continuing, resolutions and stuff like this. But because these funds have already been approved, they are absolutely fine to expend in the next year.
Okay.
Does that answer the question?
Jim? Okay. Jim, thank you. You can, the lines are unmuted, so you can speak if you like. We have another question that was from Tanya Zimmerman. Is it allowable to use children's participation time in activities and or at wraparound meetings as match?
I'm going to say that one is probably a no, unless that they are, providing a service. Again, the in-kind match activities occurs because of the exchange of goods or services. So in this case, I would say that because they are participating in an activity or wraparound meeting, that they're not providing it. They are recipient of services, not providing the service. If in fact that a young person was providing feedback or guidance as part of an overall meeting that was being held to obtain that kind of feedback, then yes, we believe that they're acting in a professional service delivery capacity. That's different. But the question is, if their participation in an activity or wraparound meeting is matched, the answer would be no.
Okay. I see some questions. Just put your name in the additional questions.
Folks can feel free to just talk.
Yeah. You can just chime in and have a dialogue here. Yes, no?
So another thing, while folks are not talking, I'll just jump in again since I'm on a roll today, that I am a believer, of course, in as much cash match as humanly possible, and I also recognize that in-kind is critical. One of the areas that we have done a lot of work in lately, especially over the last couple of years, has been with our faith-based organizations, and they can be a wonderful source of match, particularly if they are involved in activities that support the work of the system of care. We have a group that's called Open Table that creates these wraparound type of tables within our systems of care, and a lot of their work that is done that they do as in-kind services, and they can already existing kinds of faith-based activities. A lot of that kind of connectedness with faith-based organizations can definitely be used as match. Clearly the work with foundations and other charities and local businesses, if they're involved, can be used as match. I mean, all of these are nice ways to partner if there's not enough cash around.
All right, a question from Tamika. If we have a program in place that helps children using non-federal funds, can we count this program service as match?
Sorry, hold on.
Gwen, Gary?
Well, we're thinking about it. I think it depends. The program that helps children using non-federal funds. I mean, so first of all, it's possible because it's non-federal, so that's good news. The issue here, again, would probably be if it's already in existence and you're doing it, then if it's being redirected towards the grant activities. So if it's just out there, if it's just a program, and you say, oh, well, I have this nice social skills group here that we're doing it, and we're just going to count it as match, but it's not part of the system of care, then no, you can't count it as match. But if it's now connected to the system of care, and you're bringing it into the system of care, and it becomes part of the system of care, and it's non-federal, then yes, then it can be counted as match. So I guess that's why I'm hesitant to say yes or no. It sort of depends on whether or not that you can, do it that way. But it has possibilities, yes.
Okay. Other questions? You can.
Beth, this is Sheila again, and can you hear me?
Yes.
I wanted to go back to a question that Vermont asked earlier, and just sort of frame it in a little bit different way, which I think I'm going to get the same answer, but I wanted to ask it anyhow, is if, as a result of the system of care work and the grant and everything else, we were successful in getting the legislature to appropriate, $5 million in new monies for all the home and community-based services in the joint bulletin, let's say, but of course would want to match them to Medicaid in order to expand the amount of dollars available. We could not include that $5 million newly appropriated by the legislature as a result of our efforts, because it's going to be matched to Medicaid. Is that correct?
Correct, because I mean you can't use the same money to do two different matches.
Yeah,
However,
no, I understand that.
What you could do, here's my suggestion. I mean, if it were me, I'll just say it that way.
Yep.
that would make a pretty cool thing to say, that we are focused on, home and community-based services. The legislature, I mean, that state, in this case Vermont, reached this tremendous juncture here where they're really supporting this. It makes for a wonderful, overall application to say that this is what's happening, and that the next phase, I don't know if there's kids that are in residential or out of state or in hospitals or other higher end levels of care, but you could create new and additionally interesting sources of match, but be it in kind, especially right now because we've modified the program to be 4 years, where you're not matching the huge dollars in those 5th and 6th years. So all of a sudden you have a tremendously powerful application to say, look, our legislature is wholly behind this, and we will be able to develop match based on A, B, and C, even though you may not be counting the money that they're putting in to match their Medicaid reimbursement. Just my 2 cents.
Okay, thanks.
Other questions?
This is Andy Hunt. Can you hear me?
Yes.
So I want to go back to a question that Tamika had about the not meeting the match requirement. And I think Gary partially answered that, but I don't know if we want to talk about sort of the consequences of what happens when you don't meet the match. And if you are a current grantee and you feel like you're running behind on match, then you need to get in touch with your project officer and probably your technical assistance provider so they can help you with that. But if you do, at the end of the year, you find out that you're short on match, there are some things that happen. So, Gwen, do you want to talk about that, or should I?
You can go ahead, Andy.
Okay. So a couple possible things can happen if you are short on your match. If it ends up down at the end of the grant, and the grant is over and you're short on your match, then you'll be required to pay that back. So it's very important that you keep up with it, and you let us know if you feel like you're falling short, because we don't want to see anybody in a situation where you're going to have to either pay back match or we have to reduce your funding because you're in the middle of the grant and you can't meet your match. So as Gary said in his answer earlier, if you anticipate for the next year that you will not meet the required level of match, then you can reduce the amount that you request in the future. So keeping up with the matches is very important. And my bottom line is make sure you communicate with your GPO if you feel like you're getting to the point where you're not going to meet the match.
Thank you, Andy. We do have some background noise here. If you're not speaking, it might be helpful if you could mute your line, please. Andy, did I interrupt you? Are you?
No, I think I was done. I did hear some people talking in the background, so I'm not sure if everybody heard it, but I'm done.
Okay. All right. Jim Gillespie, is the maximum locality grant $1 million in federal funds plus $333,000 local, or $750,000 federal funds plus $250,000 local?
So the answer to this is that we are prepared to give localities $1 million, and then the locality, either through cash or in kind, adds the $333,000 and change. So that would ultimately be a 1.333 infused into the locality. Now, we also have the ability for states, for the large jurisdictions, they don't have to. So a state like Vermont or smaller states don't have to take the full $3 million, but we've separated so that we give an incentive for statewide approaches to the systems of care. So that would be a $3 million federal investment. And then on top of that would be the match. So if Jim, hopefully that answers your question, that it's the former, not the latter part of your question.
Other questions?
This is Denise. Can I get back to Andy's point and just ask folks to comment about when you're reporting match, you're reporting on your annual FSR match to what are actually expended or drawn down from your federal award, not the total amount of the federal award. For example, if you apply for and were awarded $500,000 a year, and you only spent and drew down $300,000, then in year one, your required match would be $100,000 and not 1/3 of the total $500,000.
That is correct, Denise. You're only required to match the monies that you use. So if you don't use them, then you're not required to match them.
And so that is also reported, just this is Gwen, that's reported on your federal financial report, your expenditures, your federal expenditures, and your match.
Okay. When you're talking about reporting, somebody did ask about additional information about OMB Circular A-133, the single audit report.
Right.
Can you go into that in a little bit greater depth?
Well, I mean, just you're required to, there is information under the new circular. It is, you can look into it a little bit more. It's the new OMB circular, new Uniform Administrative Requirements 2 CFR 200 /45 CFR, which kind of talks about audit requirements. But basically, every organization is required to submit an annual audit report each year, up to, I think it's increased to $750,000. So don't quote me on it, but have a look at the OMB circular.
Okay,
so it goes
you.
through our database, the clearinghouse, the audit clearinghouse every year.
Great, thank you, Gwen.
Sure.
Other questions or comments?
This is Denise, and I'm going to go back again to page 21 that a lot of folks are asking, and it does go back to the maintenance of effort. You've been very clear that that really should be a very thoughtful discussion with your GPO or with Gwen if you're thinking to apply. But can you confirm that the maintenance of effort applies only to the applicant agency? So if there are not many, if there's little or no mental health or behavioral health budget dollars in the applicant agency's budget, then it makes the maintenance of effort issue a lot easier. Is that correct?
Well, I don't know how we could hold non-applicant agencies accountable for maintenance of effort.
Makes sense to me. Thanks.
Okay. I'm just trying to think, I mean, I guess I don't want it to I'm trying to make sure we're not saying out of, telling tales out of school here, but it is the applicant that we're concerned about. But I wouldn't also want to say, okay, well, we're going to have, the Department of, Computers apply for an astronomy grant just because they didn't have anything to do with it. I mean, that may be a problem for the application in and of itself. So I want to say that we're worried about the applicant agency, but I also, don't think that you can skirt around that by saying that, well, if your child welfare agency hasn't done anything with mental health, that would be necessarily the right way to go. I'm just, just trying to point out that there are different approaches to doing this, and the point would be that when you're going to apply for this, to be thoughtful about the approach that you're taking.
That makes sense. Thank you.
Okay, but the bottom line certainly is that it's the amount equivalent to that expended by that applicant agency for those purposes, that really looking at those prior couple of years, those averages over those, average amounts spent over those 2 years prior for community mental health services. And that's why we're also looking at redirecting as another possibility for the match.
Thank you. Other questions, comments? Anybody?
No, this is Emily in Stark County, Ohio again. This has been really helpful. I appreciate your time.
That's great. Thank you very much, Emily. Anybody else? Okay. Sounds like we have answered all your questions. If you have additional questions or questions about something that's specific to your situation, the contact information for the presenters is included in the presentation up front, and we will be sending the recording of the webinar to you so that you can refer to it and find information that you need following the webinar. I would like to mention that we will not have a learning community meeting in March. There is a research meeting at the University of South Florida that many people are attending, and so we will have the next learning community meeting in April on the 20th, 2:30 to 4. We will always have them on the third Wednesday of the month, and we provided a link for you to join the learning community to make sure you're on the list. We will also continue to advertise the learning community, to announce it and give you instructions for registration in the TA telegram that comes out for work every Monday. We are also interested in some input from you about what topics we might focus on in the subsequent learning community meetings. The potential topics that we have thought about are family and youth involvement and leadership. Many of you are looking for some strategies and ideas that might help you with that. You do have a financing plan due if you are a current grantee, and financing strategies that you might use around expansion. Strategic communications to use in terms of how to generate high-level support, which is an essential ingredient for expansion. Those are some topics that grantees and others have mentioned to us as important. Do you have other topics that you think would be high priority for us to look at for the next few learning community meetings? You can answer, you can speak them aloud, you can answer in the chat box, you can email us subsequent to this meeting. Any ideas come to mind? Okay. Well, we are certainly available, and we would be happy to take your ideas subsequently. Please feel free to contact us about those. And if there are no additional comments or questions at this point, I would like to thank Gary and Gwen and Eric for participating in the call and answering some of our questions that are very complex. And I know that they will all be available to help you with your additional questions as you move forward with your grants and as you think about applying under this new announcement. So thank all of you, the presenters, and thank all the participants for joining us for this learning community. And we will look forward to our April 20th meeting, and we will see you then.
Thank you.